By your 70s, deep vein thrombosis, a blood clot forming deep in a vein, shows up in more than 400 out of every 100,000 people every single year. And the position you slept in last night may have already nudged you closer to that number. The way you've slept every night of your adult life might be quietly working against your heart. Not loudly, not painfully, just slowly in the background, while you sleep like you always do. Tonight, before you turn off the light, there's one change I want you to know about. It costs nothing. No prescription, no device, no appointment. And it may lower your risk of stroke and dangerous blood clots starting tonight. I'm Dr. Kemi Lawson. I've spent more than 15 years in a community clinic doing preventive care for people well past 60, and here's the part that still bothers me. Almost none of them had ever been asked which way they sleep. Let's find out where you stand right now. Sleep on your left side, drop a 1 in the comments. Right side, that's a 2. Flat on your back, 3. And if you're a stomach sleeper, go ahead and drop a 4. I've got a spot for you later in this video. I read every single one. Here's what nobody tells you. Your body doesn't clock out just because you're asleep. Blood pressure is trying to drop into recovery mode. Waste is being cleared out of your brain, and blood is trying to make its way back up from your legs to your heart through veins that, after 60, aren't as strong as they used to be. The direction you're facing while all of that happens matters more than almost anyone in medicine has ever told you. Stay with me, because by the end of this, you won't just know what to do. You'll know exactly why it works. And that's what makes you actually do it tonight. Before we go any further, I want to know where you're watching from. Leave your town or country in a comment. Sleep has always been treated like a comfort issue. Which pillow, which mattress, how many hours? Not a heart issue, not a circulation issue. Doctors ask about your salt, your exercise, your stress. Nobody asks which way you're facing at 2 a.m. That's starting to change. Over the last couple of decades, research has built up around something simple. Your sleep position is a cardiovascular variable. You spend roughly a third of your life lying down. That's not a footnote in your health. That's a full-time job for your heart. After 60, when your vessels have lost some of their youthful stretch, the position you choose starts to matter in a way it didn't at 30. Makes sense, right? Less reserve means less room for 8 hours of extra strain night after night. Let me tell you about someone this caught up with, a woman I'll call Gloria. Gloria was 71, a retired bookkeeper from a small town outside Chattanooga, Tennessee. The kind of person who took her blood pressure pills every morning without fail and still walked 2 miles most days. She wasn't in crisis. She came in because of a pattern that didn't add up. Some mornings she'd wake up to a strange flutter in her chest, gone within a minute. Her right leg felt heavy and a little swollen until mid-morning. And her home blood pressure readings, taken first thing, kept running higher than they had any business being. Her doctor had already adjusted her medication once. It hadn't moved the needle much. When I asked her, almost as an afterthought, which way she slept, she didn't hesitate. On my right side or my stomach, always have been. We'll come back to Gloria. Here's the position. The one that works with your heart, your veins, and your brain all at the same time, not against them. The left side. That's the answer. Sleep on your left side. I know that might sound almost too simple to matter. 5 reasons, 15 years of practice, and the answer is just turn over? Stick with me. Once you understand the mechanism behind it, you're not going to sleep on your right side the same way again. Ready? And yes, I see you, lifelong stomach sleepers, the ones who just dropped a 4. Side sleeping is going to feel foreign at first, and that's fine. A pillow hugged along your front, angled mostly onto your left side instead of flat on your stomach, gets you most of the benefit without fighting your whole body at once. Even a partial angle most of the night beats none at all. Now let's get into why left beats right in the first place. Reason 1, your heart isn't sitting where you think it is. Most people picture it smack in the center of the chest. It's not. Most of its mass sits left of your body's midline, tilted toward that side. That's not disease. That's just how you're built. So think about what happens when you lie on your left side. Gravity now works with the natural angle of your heart instead of against it. Picture carrying a bag of groceries downhill versus uphill. Same weight, same distance, but one takes real effort and the other barely takes any. Your heart beats somewhere around 100,000 times a day. 100,000 beats. How much easier would your day feel if every single one of them cost you a little less? After 60, When the heart muscle may already be a little stiffer than it used to be, that small mechanical advantage counts for more, not less. Left side sleeping hands it to you for free every night for 8 hours straight. Now, I already know what some of you are thinking because I hear it constantly in clinic. Wait, doesn't lying on my left side put my weight right on top of my heart? Isn't that going to crush it? It's a completely reasonable thing to worry about. It's also not how your anatomy actually works. Your heart isn't floating loose in your chest. It's cushioned inside a fluid-filled sac called the pericardium, and it's further protected by your rib cage and the surrounding structures doctors call the mediastinum. That padding is doing its job whether you're standing, sitting, or lying on your side. So no, you're not lying on top of your heart the way you'd lie on top of a pillow. You're simply letting gravity assist a heart that was already built to lean that direction. If a doctor ever told you the opposite, they weren't wrong to want to protect you. They just didn't have the 15 minutes to walk you through the anatomy. Reason 2, and this is the one almost nobody outside a cardiology office has ever heard of. It's called the inferior vena cava. Try saying that 3 times fast. It's the largest vein in your body. Well, largest by volume, there's some technical debate about how you rank these things. But for our purposes, it's the big one that matters. Its whole job is to carry blood from your legs, your abdomen, and your pelvis back up to the right side of your heart, so it can get sent to your lungs and reloaded with oxygen. Here's the detail that matters. This vein runs up the right side of your spine. When you lie on your right side or flat on your back, the weight of your organs, especially your liver, the heaviest organ in your abdomen, presses down on that vein. Think of it like stepping on a garden hose. Water still gets through, just a lot less of it and a lot slower. Quick aside, since we're talking about the abdomen, if you deal with acid reflux or GERD and you've been told to sleep with your upper body elevated, you might be wondering if that fights with lying on your left side. It doesn't. They work together. Left side sleeping is already the position reflux specialists tend to recommend because of how your stomach sits relative to your esophagus. Add a wedge or raise the head of your bed, and you get both benefits at once. We actually have a number for this vein compression too. Researchers using ultrasound to track this exact vein, measuring it directly on a screen, position by position, found that turning onto the left side increased its open diameter by about 29% on average compared to lying flat on the back. That research comes out of obstetric and emergency medicine studying pregnant patients in real time. Different population, I know, but the vein and the physics squeezing it are exactly the same ones sitting in your chest tonight. Curious what that means over a whole night, not just a scan? Slower return means your heart has to work harder to make up for less blood coming in. Night after night, year after year, that adds up on a heart that's already dealing with stiffer vessels than it had at 40. Turn onto your left side, and that pressure disappears. The vein runs free. For veins that have lost some of their youthful elasticity, which, after 60, most have, removing that obstacle isn't a small thing. Reason 3, and this is the one that worries people most once they understand it. Blood clots don't need a long flight or a surgery to form. They form anywhere blood moves too slowly. Doctors call that venous stasis, blood pooling instead of flowing, like a puddle that never drains versus a stream that keeps moving. Ever notice how some mornings your ankles look a little puffier than others? That's often this exact mechanism, just a milder version of it. It happens most in the deep veins of your legs and pelvis, exactly the territory the inferior vena cava drains. Remember that number from the start of this video? By your 70s, deep vein thrombosis shows up in more than 400 out of every 100,000 people a year, a rate that keeps climbing the older you get. That's not because older blood is somehow different. It's because circulation slows down, vein walls lose some of their spring, and a lot of medications, even mild dehydration, can thicken the blood just enough to tip the balance. A clot that forms in a leg vein doesn't always stay there. It can travel to the lungs, where it becomes what's called a pulmonary embolism. Or fragments can enter circulation that eventually reaches the brain, contributing to a stroke. Here's a question I ask almost every patient I see after a clot has already happened. What position do you sleep in? The answer is almost always the same, right side or flat on the back. I don't take that coincidence lightly anymore. Left side sleeping keeps that vein running freely, so blood keeps moving instead of pooling. Moving blood is safe blood. Stagnant blood is where trouble starts. And if you're already taking something to prevent exactly that, stay with me because this next part is for you specifically. Quick pause here because I know a good number of you watching are already on a blood thinner. Eliquis, Xarelto, warfarin, whatever your doctor puts you on after a clot, a stent, AFib, or a valve replacement. You might be wondering, does any of this even apply to me? It does. Your medication is doing an important job, keeping blood from clotting the way it otherwise might, but it's not doing the job of keeping your circulation moving well through the night. Those are two different problems, and left side sleeping helps with the second one. Better venous return means less pooling to begin with, which is a helpful partner to what your medication is already doing, not a replacement for it. I want to be really clear about this. Don't change your dose. Don't stop a blood thinner. Don't make any medication decision based on a video. Bring this up with your doctor as one more piece of the puzzle, not a reason to second guess what they've already got you on. Real quick, before we get to the last two reasons, if any of this is landing for you, take 1 second and hit subscribe. It genuinely helps this reach more people managing the exact same things you are. And do me one small favor in the comments. Type yes if a doctor has ever asked you which way you sleep. Type no if, like almost everyone I sit across from, not once. I read everyone, and I've got a feeling the NOs are going to run away with it. Reason 4, and this one surprised me the first time I read it, even after 15 years in this field. Your brain has its own cleanup crew, and it mostly only runs while you're asleep, like a dishwasher that only turns on at night. It's called the glymphatic system, named for the glial cells that form the channels fluid moves through, washing metabolic waste out of your brain tissue, or more precisely, out of the fluid surrounding your brain cells. Among what it clears, amyloid beta and tau, the same proteins researchers keep finding built up in the brains of people with significant cognitive decline and vascular dementia. Here's where it gets interesting. Researchers at Stony Brook University, working with the lab that first mapped this system, published a study in the Journal of Neuroscience back in 2015 using MRI scans and found this waste clearing process worked best in a side-lying position, better than on the back or stomach. I'll be straight with you. That particular study was done in an animal model, not in people. So I'm not going to tell you it's closed case science in humans yet. But it's a real peer-reviewed finding, and it lines up with everything else we've covered tonight. Why bring this up in a video about your heart? Because your brain and your heart share the exact same blood supply. Inflammation in the brain's blood vessels, partly driven by this same waste buildup, raises the risk of small strokes and, over time, larger ones. What helps one tends to help the other. Reason 5, something cardiologists call nocturnal dipping. In a healthy cardiovascular system, blood pressure is supposed to drop while you sleep. The American Heart Association defines a healthy dip as at least a 10% drop from your daytime numbers, and most people land somewhere between 10 and 20%. That's not incidental. It's one of the main ways your arteries and kidneys get a nightly break from the workload. People whose blood pressure doesn't drop that much, doctors call them non-dippers, show up in study after study with meaningfully higher rates of stroke and silent small vessel damage in the brain than people who dip normally. The older you are, the more that difference tends to matter. So, what does sleep position have to do with any of this? More than you'd think. When your circulation is working against a partially compressed vein all night, when your heart has to work a little harder than it needs to just to keep blood moving, your body's stress response doesn't fully power down. Cortisol and adrenaline stay a touch more elevated than they should. And that's one of the more common reasons blood pressure fails to drop the way it's supposed to. Left side sleeping also tends to ease positional sleep apnea for a lot of people, those brief airway blockages that cause sudden blood pressure spikes overnight. Fewer spikes, more consistent dipping, and a heart that wakes up actually rested instead of one that's been quietly working overtime for 8 hours. Which brings me back to someone I promised we'd revisit, Gloria. I promised I'd come back to her. What changed for Gloria over the following months is the clearest example I can give you of everything we've just walked through. After that appointment, Gloria made one change. She started sleeping on her left side. It wasn't instant or effortless. Old habits don't just flip overnight. She propped a firm pillow behind her lower back so she couldn't roll onto her right side without noticing, and tucked a second pillow between her knees to keep her hips stacked and comfortable. 3 months later, she came back for a follow-up. The morning blood pressure readings that had puzzled her doctor for months had come down, not dramatically, but consistently, without any change to her prescription. The chest flutter she used to wake up to was gone, and that heaviness in her right leg every morning? She said she'd honestly forgotten about it until I asked. Her husband mentioned, almost in passing, that she seemed to be sleeping more soundly too, less tossing, less turning. What she said to me at that visit is something I've thought about more than once since. She said, "You know, I did everything they ever told me to. Took the pills, walked every day, watched the salt. Nobody once mentioned the thing I was doing 8 hours a night." That's the gap this video exists to close. Not because the science is hidden, it's been sitting in journals for years. It's because there's never been 15 minutes in a checkup to say it out loud. You're getting those 15 minutes right now. One more thing, and I want to say this directly to anyone lying there thinking, "I've slept the wrong way for 40 years. Is the damage already done? No, or at least that's not how this works. Circulation responds to what you do tonight, not just what you did for decades. Some of the patients I've walked through this with told me they slept more deeply the very first night they tried it, before any blood pressure numbers had time to change at all. That's not a guarantee for everyone, and I won't pretend it is. But it does mean this isn't a lost cause you're managing. It's a habit you can start tonight, and your body starts responding sooner than most people expect. So here's everything that's true at once. 5 reasons, but really just one idea. Gravity and your plumbing are on the same side if you let them be. Your heart tilts left. Sleeping left lets gravity help instead of fight. That big vein running up your right side only stays open if you're not lying on it. Clear vein, moving blood, no pooling. And that's reason 3 handled right there too. Even your brain's overnight cleanup crew runs better this way. And all of it adds up to the one thing your body actually needs at night, blood pressure that's allowed to drop. Here's exactly how to set it up tonight. I'm going to walk you through this like I'm standing right there with you, because I know a lot of you asked for this kind of detail. Lie on your left side first. Take a firm pillow. It doesn't need to be huge. Wedge it lengthwise against your lower and mid back, angled so it supports you from behind your shoulder blade down to your hip. That's what stops you from rolling flat onto your back once you fall asleep. Then grab a second, softer pillow and place it between your knees, letting your top knee rest on it rather than dropping onto the leg underneath. That keeps your hips level and takes the pressure off your lower back and hip joint. Your top arm can rest on another pillow in front of your chest or just relax down along your side. Either way works. If you want a simple way to remember it, back braced, knees cushioned, front arm free. Now, I know what some of you are thinking. What about when I roll over in my sleep? I can't exactly control that. Totally normal, and I wouldn't stress over it. You don't need to be a statue all night. Falling asleep on your left side and spending most of the night generally on that side still gives your heart and your veins the benefit, even if you shift around some. That pillow behind your back is there to make rolling all the way onto your back harder, not impossible. Give it about a week. Most people stop thinking about it entirely by week 2. Your body finds the new pattern faster than you'd expect. Here's what I'm asking you to do, not next week, tonight. Before you get into bed, set that pillow behind your back and one between your knees. That's the whole action. The rest happens on its own while you sleep. What position have you slept in for most of your life? And has anyone ever asked you that before tonight? Tell me in the comments. I read everyone. And if someone in your life is managing blood pressure or recovering from a cardiac event, send them this video. If tonight's the first time anyone's ever walked you through this, that's exactly the gap this channel exists to close. Your heart has been working for you every minute of every day for decades without asking for anything back. Tonight, turn to your left and let it rest a little easier.